So there we go. Perfect. Perfect timing. So what is evaluation? If we look at the definition of making a judgment about the amount, number, value, or value of something, it's an assessment. For our purposes, a lot of it will be collecting and analyzing data to assess program efficacy and effectiveness. We want to make sure that what you're doing is doing good work. What does it have to do with me? It's the process of measuring change. It's how we demonstrate that our programs are doing what they should be doing and affecting the communities we work in. So it's how we can demonstrate that the money that's being spent doing these activities is for good. And additionally, one of the main things that we kind of forget about, but is huge, is informing future improvements and expansions of the work we're doing. A lot of this information should be able to help propel the next step of whatever needs to happen. So in terms of quarterly reporting, I know that you guys submit your actual contract monitoring quarterly reports to your CCPD POs. That is not what we're going to talk about here. We're going to talk about the evaluation side of it and what that is going to look like. So grantees will submit, this is process data in a standardized format. That allows us to be able to aggregate data across all grantees and track over time. So we can look at the whole CCPD portfolio over the length of the grant cycle, sometimes looking back at other grant cycles. We can see where activity is being done in terms of counties and cities and those kinds of things, and what kinds of activities are being done in which counties and cities and all of those things. So having everyone report the same metrics really allows us to bring all those different things together to be able to look at the bigger picture. This reporting is focused on grantee outcomes as developed in your implementation plans. And it's created with pre-populated data to try to ease the reporting burden where possible. Though I will tell you that Q1 is going to, well, Q2, I guess, this first quarter of reporting is going to be a heavier lift because we have to fill in all the basics that in the next couple quarters will pre-populate for you. And you'll just have to say, yes, that's still the same, or, oh, we made some changes. So we know that this first quarter is a little bit heavier lift, but we're here to help, and we're going to try to offer some stuff a little better. So in terms of the EDS access, you will receive an email from CPEG with the link for the EDS, your agency's unique login identification, reminders and helpful hints, anything that comes up here today in questions, other things that we come up with that we think would be helpful for you going forward. We'll include those in that email, and the dates that you need to know of when things are due and all of that. Let me dive just a tiny bit deeper into that. The link is a universal link. All agencies will end up with the same link, but your unique login ID is your password that's going to get you in. That password is for your agency. It is not user specific. So if you have multiple people at your agency who are going to be working on the reporting tool, that's fine. You will all use that same login ID. This goes in my reminders and helpful hints. If you have, you technically can have multiple people being logged into Qualtrics, which is the system this is all built in, at the same time. I do not especially recommend it. As reporting systems get more and more slick and complex and sophisticated, they are also less flexible in a lot of ways, and that is one of them. So you can have multiple people in there, but sometimes it will lose data. So I'm just going to give you that warning now. Okay. Yes, so then next step. This recording, the user's manual, any other those helpful hints and stuff will all be posted to the CPEG site for your review. And links will be sent no later than January 2nd. So I will say that I think we promised a slightly earlier date than that, but this is a good thing. CPEG is going to be closed December 25th to January 2nd, and we don't want to leave anyone hanging out there without the support they need for this new tool and all the things. I don't want something to go wrong and you to freak out and spend your time spinning your wheels when it's something I could have helped you fix really easy. So we're going to make sure, also I'm going to make a couple more changes just to make sure it's like in as best operating form as possible before it gets to you. So those links will be sent out, they'll be sent out January 2nd. And we are extending the submission date to January 19th from the 16th. So we're giving you a few extra days to make sure you can get all the things done and stuff to accommodate for that. Having done this with the STEP program before, I also know that really nobody's working on it January 25th to or December 25th to January 1st. So I don't really think I'm taking away work time from you. If there is any dramatic problems with this, reach out to us and we will work with you to figure it out, okay? Onward. So your link will take you to a login page that will precede this page. And it'll basically say, hey, you're here. What's your ID? So you'll have a unique agency ID that'll be 3 letters dash 3 numbers. And that's what you're going to use as your little password. Put that in and ta-da, it'll put you into this. The only thing that I have set to pre-populate this time is that you are the greatest agency, and it will tell you your name here. Everything else we want you to go ahead and put in so that we have the most appropriate, best contact information and all of that. If you have anyone else that the link will go to who we have on file as the person who should be receiving this kind of information. If there's anyone else that you want to have included for evaluation correspondence or follow-up questions and anything like that to go to in the future, please go ahead and give us their name and emails here, and we'll keep those. And if there's any questions, these additional people can be copied in on questions to pipe in on that stuff. See, it's not scary yet, is it? It's going to be great. You're going to love it. Okay, so the next part is going to be where we go to choose your own adventure. This is where you select your area of activity. If your program activity is in direct services, that's NDPP, DSMES, SMVP, and HBAM, you will select direct services. If you are working anywhere in PSE, CSQI, and innovative, you will select PSE, CSQI, and innovative. I will make a note right here that SBAM and CPC live here in the innovative section, so don't accidentally go down the direct services path because you will not like that adventure. This is what you are prepared to answer, okay? So in terms of directs, let's see. Yes, we're gonna go down the direct services path first. You pick whichever of these you're working on. In direct services, I understand that you can be working in more than one area at a time. And so you select all the ones that you're working in. So if you are working in NDPP and DSMES, you can select both of those, any combination of them. What will happen is that you're going to go through the whole reporting block basically for NDPP, and then it'll come up and you'll start again and do it for DSMES. And there will be cues to tell you what's going on, so you don't have to think about which one you're doing at any given time, but you can select multiple ones here so that you report on your multiple programs. Okay, so in direct services, there are going to be 4 sections that you're going to complete for each of your program areas: definitions, baseline, program details, and quarterly activities. This is, we're going to talk about how frequently you're going to do each of these. As I said, this first quarter is going to be a little bit of a heavier lift. So first, you're going to do this definition section in the first reporting quarter of the grant cycle. If you were to make changes to your definitions, you'll have the opportunity to do that, but ideally your definitions will be set now and they will stay the same for the reporting for the grant cycle. Again, if there are changes can be made later on. Baseline, you're going to complete in this first reporting quarter of the fiscal year. So in this year, you'll do it in quarter 2. Next year, you'll do it in quarter 1. Same for FY26. The program details, same, you're going to complete in the first reporting quarter of the fiscal year, but there will be the option to update these in subsequent quarters. So each quarter after this, you'll go through and kind of just glance over and make sure that all of that data is still appropriate and kind of just move on from there. There's not the heavy lift of having to put it all in there. And quarterly activities, and this is what you're going to be working on every quarter throughout the grant cycle. This will come to you blank every quarter and have you fill in new things, even if, and you'll see it as we go through, your activities are the same quarter to quarter. We're going to have you report them every quarter. You won't just update. Okay. There we go. Okay, so the first section is definitions. And in my example here, I selected NDPP. but you'll select whichever one yours is. And in terms of definitions, they're going to be different from grantee type to grantee type. So we're going to define eligibility, enrollment, and program completion. So the first one is eligibility. The CDC defines NDPP program eligibility as, and here's what the definition for eligibility is that we're using for this program. The question is, are you using the above CDC eligibility definition for your program? Yes or no? If yes, this is your program eligibility definition, boom, you go on to the next one and you'll answer the same question about the enrollment definition. If you say no, we have a little bit of a difference. We're doing something a little bit different. You're going to get sent to this question. What is the reason for not using the CDC eligibility definition for your program? And please provide us the definition you are using. Again, with the being able to aggregate all the data across all the different grantees, we want to make sure that we're working with the same definitions of who is eligible when we're collapsing data into groups of who was served in different ways and stuff like that. So you're going to do this all for eligibility, and you'll go through the same process for enrolled and completers. And those are, excuse me. So you kind of go through the three different ones. If you said yes, you just skip through. If you said no, we need to tell us what you're doing instead. And then we're already done with the first block. We're on to baseline. So for the NDPP program baseline, we give you a little snippet at the top to tell you what we're looking for in the next section, so you know what's coming. The first question is your project goal. This can be copy and pasted directly from your implementation plan or your scope of work, or it might be in the materials you submitted for application, wherever it is, whatever your project goal that you have, and sure that it exists somewhere, and we'll ask for it right here. And then what counties are you working in? This is baseline. We're looking at counties you plan to work in or are currently working in. So if you know that in Q3 you're starting something in Kit Carson, go ahead and indicate Kit Carson here. This is our baseline. This is where we are planning to work. If you are working statewide and you're genuinely in all the states, down here at the very bottom, there is a statewide button that you can push, so you don't have to click every single county. The next part of baseline is target populations. Which populations will be targeted by the program? Race, ethnicity, mental health, low SES, persons with disabilities, Medicaid, rural. If you just indicate any and multiples is fine. If you're working with a race ethnicity group and in rural settings, that's fine. You can select multiples there. If you select that you're working with to target race ethnicity, I'm going to ask you which race ethnicity you are working to target. I'm going to tell you right now that these groups are still a little bit in conversation, so they may change slightly, but they will only change to expand to include more groups that you are working with and best collect your data, okay? So don't freak out about that. The next section is reach and program capacity. These are estimated for the year, because again, we're starting this at the very beginning. The number eligible to participate this fiscal year, the number eligible who self-identify as your priority population this fiscal year, and the percent you hope to recruit from your priority population. And if you have any questions about where to get these numbers or what you're looking for here, follow up with your CPEG specialist, Zeb and Nicole. They know these things and how to get you the right information so you know what you're reporting on. In terms of your capacity details, we're looking for the estimated total number of sites this fiscal year. So again, you're doing this at the beginning of the year. It's not how many you have active right now. We're looking at how many you think you're going to get to this year. Is your program group, cohort based, or one-on-one? The number of new cohorts that you estimate you're going to have this fiscal year. Maximum number of people who could enroll in this fiscal year. The date of the first cohort in this fiscal year, and that one I believe will be a retrospective to Q1 if we can have that. Start all the way back of when your first group was. Anticipated time between, just tell us if it's a year, 2 weeks, 3 days, whatever yours is. And then these are a little bit separate. Does your program have a wait list? And if yes, are you able to successfully enroll participants from your waitlist. Next section, referrals and outreach. And instead of copying all these from the tool itself, I'm just giving you the block here of what all these questions will be. You will have a open text box to fill in. As I mentioned, I really recommend taking this directly from a template, being able to copy and paste it into the tool itself. We will give you a template with all the questions in it and everything so that you can fill it out and go one by one and do those. We're looking for, how do patients find out about your program? Is there a referral system? Do you outreach directly to patients? What are your outreach strategies for priority populations? Do you have a referral system out to outside partners, especially around the social determinants of health? And please explain that. Okay, so next section, program details. Here, again, these are estimated based on the fiscal year. You're going to fill this out again at the beginning of the year. So we're going to start there. The site types that you have, the number of each site type estimated that you're going to work on this year. So the number of clinics, community organizations, residential facilities, home-based, including multi-unit housing, health fairs, work sites, and other. And if you select other, please let us know what it is. The next section is looking at the curriculum that you are providing in trainings and whatnot. Again, this is the NDPP. So these core modules are NDPP based. Here's my next little quick look. Each section will be disease area specific. So if you're working in HBM, what you're talking about here will be a little different. This is a two-part question, the core modules and the core maintenance modules. So it's slightly different depending on which disease area you're working in. But I believe you guys know what all those are better than I do. And then the next question is, do you tailor the curriculum for individual cohorts at all? Yes or no? And describe any adaptations you are making. For example, if you're address health inequities and or social determinants of health. Okay, so then we have our quarterly activities. So this is the end of the stuff that we will finish the one time and hopefully not really have to make major changes to in the following quarters. And this is where we're going to start. These are the things that you will report on every single quarter. The first section is partners and stakeholders, the number of established partners and types, the number of new stakeholders this quarter, the type and a little description about them. And the next, Then the next two questions are, what outreach strategies were most effective in recruiting new partners? What outreach strategies were least effective in recruiting new partners? Are all my things on there? I feel like I didn't get all my things. Okay. There we go, everything, okay. The next section will be reach. Again, this is a quarterly reach instead of the estimated reach that we did in the baseline. What was the program reaching capacity this quarter? Total number referred into the program, eligible to participate, enrolled, number of cohorts that were started. Quicker, happy. Number of cohorts that were completed, number of, and this is NDPP again, so the number of lifestyle coaches that are currently trained to deliver the intervention, and that is currently trained, not were trained this quarter, currently trained and available, and the number of new sites that were initiated this quarter. From this, we're also going to ask for the demographics of those who were referred into the program and eligible to participate. So this number here should break down into these groups. I know that my age group areas are switching a little bit, and there's probably another race group getting added. So just know that when you see this. Waitlist and referrals. Do you currently have a waitlist for your program? And I know that sounds like you've heard that question before, and that's because it was asked in one of the baseline questions, but we're asking it here again in the quarterly questions. It is what it is. I'm sorry. Do you refer clients to other programs when you have a wait list? And then the number of referrals to SDOH resources. The other question here is, do you provide other services beyond direct services, such as cross-cutting programs to those with multiple chronic diseases? And that's an easy yes, no. Okay, and then that is the end of your quarterly reporting data. If you at any point need technical assistance, this is in there, but again, you can reach out to us at any time. CPEG is available to help. There's a link to the website. There's our email address, which is included in here many times, and I'm sure you have from Nicole and Zeb as well. So what this says is this is the end of your quarterly reporting for NDPP. Click the arrow to navigate forward to the next section. If you selected that you were working in more than one program area, you would now start into the next one. So you would go back and it'll say, hey, now we're reporting on your DSMES program. And you'll go through all the same questions for your DSMES program. So that's how that is handled. You go all the way through one and then all the way through the next. I haven't gone back to choose our other adventure yet. I'm going to follow through with what the direct services are going to see. After you have finished reporting on all your program areas, you would come to data submission. Here it's going to tell you your direct services, National Diabetes Prevention Program. And so that's so you know if you're reporting on multiple program areas, that this is the one where you're going to add your files for NDPP. So if you have biannual data dump, you can drop it here or navigate through to attach files. Yeah, so you go through your first one, and then at the bottom of the page, it says, do you need to upload data for another program area? And you say yes, and then you'll select from a drop down of which other program area. You can go through that. So I think we have the ability for it to go through 3 different program areas right now, if necessary. If I need more than that, that can be handled. If you don't have enough space to upload all the different data files you need to upload, just reach out and let us know. And then after that, you'll go to the submission area. The direct services side is built in linearly, so you can use this back button to navigate back and back words to have other people review the data before submitting if you need to. That's totally fine. And then when you get back to here, you would click I'm ready to submit and submit. Ta-da! Now we're going to go back and choose the other adventure. So if you are in the PSE CSQI side of things, we're going to start that here and innovative. So here we go, choosing this adventure. All PSE CSQI innovative grantees will follow the same basic structure and metrics. So similarly, that all the direct services have similar questions. The same is true on the other side as well, but the structure is a little bit different. So PSE, telling you guys have 3 sections-ish. Oops. None of my cool animations are working. It's fine. Okay, so you're going to start with a baseline, then you're going to enter your program objectives, and then we're going to report on quarterly activity.
I try not that much room in the cabs.
So our baseline community assessment piece, this is what it's going to look like when you get in there. Navigate over, baseline, the following will ask questions about your program to identify the overall need of the program among the target population. Okay. So the first section is a bunch of individual text boxes that, again, paste directly from your template that you're using for. What communities are targeted for this intervention? How are these communities identified? Was it counties, cities, zip code, etc.? How are these communities selected? Describe the characteristics of the target communities or populations, include number and size, characteristics of residents in the areas, etc. Are you targeting specific priority populations? Which priority populations, if you are? And describe the current problem issue as it relates to your program area. What are the current default choices, if not healthy ones? What individual community attitudes, beliefs, knowledge are driving these choices, and how do you know? So again, these questions will each have their own individual text box for you to answer. I'm going to tell you there's probably about a 400 character limit on those. So we're not looking for a novel. We're looking for an high level view of what's going on. Baseline community assessment. So we're going to describe the current utilization, how many people are currently utilizing your resources, and how many people need to use the resources for measurable change. Again, if you have questions about what these are, where they're coming from, Zeb and Nicole specifically, we'll be happy to help you figure those out. And then there's another section of questions, and this is on the side of, this is the heavier lift. It's the baseline. You'll only have to do it this one time this quarter or this year, maybe ever. So there are more text heavy questions to complete. The next ones are, what policies already exist and where are the gaps? What contextual or environmental factors influence the policy environment? Are they susceptible to policy efforts? Is this a community priority? Based on what evidence? What is the level of community interest or need? And how will you ensure community voice in your efforts? And that finishes the baseline section for the PSE plus side of everything. The next section is the program objectives. So for this one, we're going to ask you to count in your implementation plan exactly how many objectives you have. That number may be 3, that number may be 5. I think it's probably in the 2 to 4 range. Put that number here at the top, and then you can copy and paste exactly your objectives 1, 2, 3, 4, 5, 6, 7 directly from your implementation plan to here. They will read through a little bit because we're going to use those in our next pieces. So what I've done here is I've said I'm using 3. I have 3 objectives in my implementation plan, and here are what they are. These boxes are going to allow you to enter a lot more information than you can see in the box itself right now. So again, with the use of a template, you'll be able to copy and paste and put it right in there. Okay, so this is the meat of what we're going to be reporting on. Here is our quarterly activity. What is going to happen is that it is going to read in here what you said your first objective was. I said it was called objective 1 was objective 1 details. If you look back over here, that's exactly what I said. That information is coming through so I can revisit what I said I'm going to work on. The next thing that we're going to do is, copy and paste directly from your implementation plan each of the sub-activities related to objective 1. So you may have 2 sub-activities, you may have 5 sub-activities. I think I have space for 7 or 8 here. I don't think anyone has 7 or 8 sub-activities in their implementation plan for one objective. Okay, so copy and paste your sub-activity directly from the implementation plan. The next column, you're going to just select which primary activity this is related to. Again, you might have 1 or 2 primary activities that each have 1 or 2 or 3 sub-activities or objectives, which each have 1 or 2 sub-activities. This is all just allowing us to hook it all back together when we're trying to put it all together. The next column is going to ask if this is related to a specific initiative, policy, systems, change, measures, and select which one. There's a drop down here, which you'll select if it is related to one of those. I think I didn't put the drop down list in here for us right now. And then what is your role? You could select that you're the lead, you're the partner, you're providing technical assistance, and I think other, and you select what you're doing. Specifically on this sub-activity over here from column A that we're reporting on right now. This column is going to be your heavy hitter column where you're going to put most of your information. I'm going to go back to the whole template thing because, again, the amount of information that you're going to want to use is going to be more than the 15 characters that I'm going to be able to see in this box at one time, which is why I want to be able to copy and paste it directly in there, knowing it says what I wanted it to say. What you're going to put in this box right here that says briefly describe your activities this quarter related to this sub-activity. So based on this sub-activity, what I actually did, what was my implementation? Did I attend meetings? Did I hold focus groups? Did I any of the other things that you're doing? And all of the things that you did related to this one sub-activity will be in this one box. So we won't use the same sub-activity 4 times over here. Everything that you did related to this sub-activity flows into this activity box here. If we have questions about that, we can definitely help with that in a minute. Okay, so this is the same page. It's just I dropped my orange boxes. I have outlined here that I have objective 1, subactivity 1, objective 1, subactivity 2, and objective 1, subactivity 3. Okay, looking at this 9-step framework, here are the different pieces that you can select. I believe you guys have worked on this a little bit, or there was some mapping of what different things should probably match up with for you. If we have questions, again, Zeb and Nicole are happy to answer all the questions about this. I'm a little bit happy, but not as knowledgeable. Okay, 9-step framework. So you select which of these pieces of the 9-step framework most identifies with this sub-activity that you're working on. The next column is the progress status score. You're going to do that every quarter based, again, on the sub-activity itself. How close are you to finishing all the things that the sub-activity wants you to do? Are you halfway there? It's a 0 to 6 scale of haven't started to all the way done. And you just pick where you are at this quarter. Are we halfway done? We've done half the things that we say we're going to do in that sub-activity. We're right on track, no problem. This next section is we're looking at setting. What setting or sector of the community did this activity affect? And there's a whole list of options of where this activity may be taking place. Is it statewide? Are you working in schools? Is it at community centers? Those different things. And then the next column allows you to break it down a little bit further. Is it, again, are you working statewide? Are you in a specific county? Name all the counties that you're working in. Are you in a city or town? Name the city or towns that you're working in. Is it a specific organization that you're working with? Those different kinds of things. Yep, break it down with the specific setting of where you worked this quarter. Where was the work of the activity from column 1, 2, 3, 4, 5 done this quarter? Where did that happen? Okay, there's space for 7 different sub-activities. Remember, these are related to the specific objectives. So again, that objective is up at the top. The sub-activities fall. I mean, this should be really copy and paste directly out of your implementation plan. The bottom of that page, the question is that you'll be asked is, was a new municipal or organizational policy passed this quarter around the efforts of this objective? Yes or no? If no, okay, you'll go on to the next section, no big deal. If yes, a new policy was passed, we're going to ask you a few more questions. So if yes, the next questions are going to be about the policy or policies that were passed related to, and again, it's going to tell me that I'm working on objective 1 here. I'm going to ask for the policy name, the jurisdiction. Is it, whether it was municipal or organizational, where did it happen? Is it a town? Is it a county? Is it a golf course? Whatever it is, the organization, office park, something like that, wherever it is. What is the total reach of the new policy? And then we added in, how did you calculate the reach for this policy? So just let us know, especially if it's an organizational thing. Did you say that it's an office park? So all the capacity of the office park is our reach calculation or something like that. And then we're going to want to know about the different race ethnicity groups that were, that are affected by this, and the age group breakdown. This isn't looking for an actual number of people. This is looking for these are groups that are affected by this. And I'll note again, the age group one will change. And then the last one is low SES. Does this specifically impact people in a low SES area? You may have passed one policy, you may have multiples. Again, if you need more than this, let me know and I can help you out. The next question that we ask is, did the policies use model language from other past policies or from literature or other efforts or partner organizations? Yes or no? And then please provide any key phrases or a section of policy that relate back to your project goal. So how was this part of what you are working for? And then the next section is challenges of facilitators. So if you had indicated that no, you did not pass on any policies this quarter based on the objective 1, you would skip over all the policy questions and go directly here to challenges of facilitators. Over here on the far left, you can see that it's reading in the information so I know what I'm talking about. My objective 1, subactivity 1, objective 2, subactivity 2, and that's just how I labeled them over there. It will read in what your actual text says, so you know what you're challenges and facilitators relate to. This area is, I'll say, optional, but it allows you to give some context if some work was done or not as much work was done, or you're not quite where you wanted to be, or maybe you got really far ahead because you hit the jackpot and something really worked out. So there's that, but you won't get dinged for them for not filling something in. So if you don't have anything to report for it, that's okay. Instead of using none or NA, just leave it blank for us. That really helps. And then when we say briefly, I'm thinking 1 to 2 sentences, not 4 to 5 paragraphs. So if you have more than one objective that you reported at the very beginning when we were putting in our number of objectives, now you're going to go through the whole thing for objective 2. You'll go through this whole meat of crux of everything here and report on whatever your objective 2 is through the same thing. And then similarly for objective 3. So you'll go through the same process. So when I say ish, it's because we report on objective 1, then you report on objective 2, then you report on objective 3. So however many additional objectives you have, you'll have to go through that little loop of things. So you're reporting in 3 sections, but over more than one objective. I'm working to try to see if I can allow you to be able to go back and forth while you're still at this point, without jumping out of the loop. So if you want to have someone else review anything and stuff like that, I will let you know how that ends up. Right now, once you advance to the data submission page from the PSE side, because of the way the other side loops, it won't allow you to go backwards and enter that again, which will be okay. And I'll talk about it in just a second. So same thing with data submission. You can see that you are doing PSE built environment. In this case, I apparently changed from the NDPP goal. Nope. Yeah, PSE, totally different. Built environment that we're working on here. You're gonna, if you have files to attach, you're gonna attach them here. If you don't have data to upload, because that is not part of your program in your plan, that is fine. You just navigate forward, leaving this blank. No big deal. Report submission. So as I was mentioning, I turned on subtitles somehow. As I was mentioning, if you're on the PSE side, you may not be able to navigate back right now. I'm working on that. I'll let you know what the end result of that is. Direct services, again, you should be able to go all the way back and forth. Either way, if you need help, reach out to us. If you get to this point and you need to go back because someone else needs to review your data, that's okay. Reach out and we have a way we can help you work back and get someone back to the beginning to be able to go through and make sure everything falls out that way. I understand that can be kind of frustrating. Not a big deal. Don't worry about reaching out for that. We will help facilitate that. No problem. And then if you're ready to submit, you're going to hit the I'm ready to submit button and click next, and ta-da! Your evaluation reporting is complete. So that was a lot of me talking at you about a lot of metrics and a lot of variables and a lot of things that it feels like it's a lot to fill in, but you can totally do it. I don't think it's going to be that bad. So with that, I'll let you know that if there are any questions after you have completed your submission, you click the submit button. CPEG will review your information, follow up with any questions that we have. I'm working to set up the data that it can kick out a copy to you and directly to CCPD so that everyone has the information that was submitted, and also to CPEG so that we can look through and follow up with any questions. If you have something that we feel like it's questionable about how it was entered, the reach number seems really big or really small based on what you're doing, those kinds of things, that's what we'll follow up about to fix. And know that this first quarter will be a much heavier, okay, I've already said it's gonna be a heavy lift. It's not gonna be that bad. It's a lot of copy and paste. You can totally do this. And there will be a lot more hand-holding. We're absolutely here to help you with whatever you need in January. All the different pieces. That's what we're doing. We're here to help you. And I had one more awesome thing I was going to say about that. Oh, additionally, when we go back and review all the information, if there's things that need to be changed, we just want to get them early so that when you go to enter your Q3 data, we've got it all flowing the way it should flow and everything working how it should work. So, okay, that's enough of me. With that, are there any questions?
And before we do questions, I had a couple comments, if that's okay. First off, thank you,
Of
Shannon.
course.
This is beautiful, and I very much appreciate you walking us through. I just want to remind PCE and Innovative and CSQI, that table will be very similar to all of kind of what we've shown for mapping. Just a reminder, we know that you're not doing all your sub-activities in Q2 or Q3. So
Yeah.
you can report on just your sub strategy that you're working on in that quarter. And then it will populate again when you need to update, because there's that like shift of the progress, like, oh, we just started it. Then you go back in, it's right there, we engaged partners. And now we've done some more work. You put in the description of what you did for that Q3, and then you can update. Now we're halfway through. And so it's sometimes there's a lot, like Shannon's saying, there's a lot to kind of hopefully copy and paste from the IP and from your scope of work and application. So it'll help, but it'll also self-populate in certain areas. And
Yeah.
also for those grantees that are doing the mapping, please reach out to us. We will have meetings, we can walk through together and help you do that template together to really nice and clear and helpful through that process. So now we can do questions and
And I know if there aren't questions now, there will be questions in January, and that's okay.
yes, Jody.
A webinar couldn't go past without me asking a question. So,
Love it.
so with the project I'm working on, we have two objectives. One is related to all of our policy work. And the second objective is related specifically to evaluation tasks. So should I report on the evaluation of the evaluation or just on the program piece?
That's a great question. And that's across the board. If there's evaluation, no, that's not specifically for yours. We knew that you're reading the objective, and it's like a lot of sub strategies, sub activities and things that are going on. And that's why we try to expand that. So that you're one of the reasons where we made sure there was a lot of room in one objective. So yeah, thank you. That was a great question. So no evaluation. We don't need to do a double evaluation. Thanks.
Great, thanks.
Thank you.
I have a question. I realize that I have a lot of very little like specific questions about our program and reporting. And I'm sorry, is it Zeb and Nicole I'll be reaching out to in the new year about those? And can we advance through all of the different sections without inputting previous data so we can get all of our questions gathered together and answered first before we start inputting?
Well, I think, yes, we're ready to be available, me or Zeb. Sorry, Zeb, I just kind of jumped on it, but I just wanted to remind people before Zeb probably jumps in, that we'll have a template too. So when you go through the template you can kind of also maybe have some questions, and you'll be getting that in this week. So that can help kind of guide you too. And then this webinar will help too. Then actually Shannon might have a question on going through it.
There will be some things that are required for you to advance. So I would say, but the template will be exactly word for word each question that's in there. So if you go through the template, you should be able to pull up most of the questions that you have. Hopefully.
So I noticed that one of the primary data collection questions is about municipal policies, which is fantastic. But one of the things that we've struggled as PSE grantees is demonstrating the progress that we make towards policy, since policy takes so long. Do we upload all of those data elements into that like biannual additional data file that you mentioned? No?
I'm shaking my head, Nicole, tell me if I'm wrong. So you're thinking of, as you're going through all the pieces of process toward passing a policy.
Yes.
Yes. So what I believe the big crux of the thing on the PSE side is that you're going to have all the different pieces in the 9-step framework. And in theory, you'll go through each of those 9 steps, and getting all the way accomplished on all of those is what leads to policy passing. So no, you don't need to upload all the different pieces from all that. It will be recorded when you're ranking how far along you are on each different policy piece on each of your sub activities. Does that make
Okay.
sense?
It does. So we will be able to put quantitative data
Yes.
there as
Yes.
well. Okay. That's what I needed to know. I knew there was qualitative information, but wanted to make sure we could say like number of city council champions, number of city
Yes,
council meetings.
that's what we,
Okay.
that's what we want to hear in the activity piece. That's exactly what should go in there.
Wonderful. Thank you.
Cool, thanks.
And Stanley had a question in the chat. How different is the format from what we submitted from CDPHE quarterly on our goals? Basically, the quarterly reporting is more of a check-in for CDPHE. It gives them, they have their own specific questions. We do get a chance to look at it for kind of additional information, but it's complementary, not duplicate. The only thing that I would say is that there is, it seems like the successes and challenges that we'll be asking you at the end of the year, you are asked on your quarterly report, but it's different because we're looking at stepping back and having you reflect of what were your challenges with the program for that year, not the quarterly challenges that can be different. And we found that in STEP to be different. But yes, if you look at the metrics, they're complementary to them to kind of get a full picture. That helps, Stanley? I don't know. Especially for SBAM, like we've done a really tried to do a really good job of like breaking it into seeing what you're doing as the direct service pieces, but also with you consider it innovative and CSQI, because you're really getting these programs into the schools and really doing the criteria, establishing a criteria for that program. It's really important too. So we're trying to track all of those stats within our metrics and see how others can do it, best practice. So we like that.
See, Amy had a question in the chat. We're considering quarters the same as we count them in the fiscal year. So in this year, our first reporting quarter will be Q2. And the next year is the baseline, and those updates will be done in actual Q1. So October to December will still be Q2, and you'll report what you did in Q2 at the end of Q2. Sorry, that's my dog. Yes, this recording will be available. As Nicole just said, we'll put it on the virtual access point CPEG site. And there was one other question in here. Does the EDS tool replace the last evaluation site? So this is not involved in building your evaluation plan or your metric or your logic model or anything like that. But it is what you'll use to report what you're doing, which is actually probably based on that model now. Does that make any sense, Sean? Cool. Made sense. And again, if you come up with other questions, feel free to reach out and we will try to put together kind of the FAQ kind of stuff and keep that posted on the virtual access point too. So if there are things that are pretty systematic, we'll share it out to everyone. But if it's things that were kind of one-offs but might help you, check there to see if there's any response. Thank you all for coming.